You want to take away my alcohol, my red meat, my fat, my salt.
Your sweet dessert.
You're like Christmas
red
Scrooge
wine.
come early.
No, well, what I want to say, and what I'm going to say later, is that as well as having rights as part of the NHS, that, you know, if we're ill, then whatever the time, we can get the treatment that we need. We also have responsibilities, and responsibilities to help to prevent ill health, and that's for people, but it's also for companies, and it's also true for us in government. Now, I also think that on this agenda we need to be more targeted. So you mentioned alcohol, for instance. Lots of people like to have a drink, and the guidelines say that it's perfectly reasonable to drink in modest amounts and reasonable amounts. But a third of the alcohol consumed in the country is consumed by less than 5% of people. And so I do think that we've got a responsibility to be more targeted in our interventions on alcohol, in the same way that whilst you can still smoke, there's been a campaign over a generation to reduce the amount of smoking, and that's been extremely successful. Smoking's down to just 15% of the people. So we need to be more targeted, but we've all got a responsibility.
Are you, Mr. Hancock, are you practicing what you preach? What's your health regime like? Have you cut out alcohol, salt, fat?
I try to drink only responsibly. Of course, I like a drink, and we actively go out of our way to say that that is fine. And actually, we should be more targeted on the people who have significant health problems because of the amount they drink. You know, this fact that such a small proportion of people drink such a large amount of the alcohol, and that has a big impact on the NHS, not just in terms of inpatients, but also people turning up at A&E very drunk, causing violence towards A&E staff, and that's a big problem. So I try to practice what I preach, but like all of us, I'm a flawed character, and I don't always get everything right.
Well, if you don't get everything right, what hope is there for the people who have already gone too far down the road of getting it wrong? I mean, you don't have a problem with alcohol, and you can't cut back as much as you want.
Well, that's not quite what I said, but nevertheless, the point is still valid. This is where we need to have support from government too. So everybody's got a responsibility. I want the NHS and the health system to focus more on prevention and not just on cure. Of course, it's important what goes on in hospitals and treating people when they're in hospital. But actually, the stats show that about 80%, about 4/5 of the impact on how long a healthy life you're going to live comes from things that happen outside of hospital. The environment you live in, the choices you make, and of course your genes. So we need to put more focus on keeping people out of hospital in the first place.
So,
I want to see, for instance, the proportion of funding that we spend on primary care and on community care go up as part of the extra £20 billion
what about,
okay,
let me interrupt. Let me just interrupt, because what about the cuts to public health budgets? A report by the Health Foundation last month says you've been short-sighted and irresponsible with your cost-cutting. Public health budgets which underpin ill health prevention initiatives, which is exactly what you're trumpeting this morning, as well as addiction, which you've just mentioned, have been cut by almost a quarter between 2014-15 and 2019-20. How can you say, on the one hand, we need to do more to prevent ill health, stop people making their way to hospital, and on the other hand, take away a quarter of the budget to do that?
Well, in the budget just a week ago, we put an extra £20 billion into the NHS.
Not into public health.
Several years ago, I'm coming to that, and I want to see a bigger proportion of the NHS budget in the future going into primary care, into community care, into this agenda. But also, we have devolved the budgets for public health spending to local authority level. That's because there's wider determinants of health than just the public health spend. That's important, but also things like housing, the environment, air pollution. It's much bigger than just what happens in the NHS, and that's why this was given to local authorities who have an impact on lots of those other things as well, to try to make sure that the approach that we take is more joined up.
And according to the
Royal
Royal College of Nursing, Mr. Hancock, reported figures from Labour, local authorities in England, exactly what you're just talking about, will reduce their public health budgets in 2018-19 by 85%, a total of £96.3 million.
No, I don't recognise that figure. But what I do recognise is that last week we confirmed the £20 billion extra for the NHS in the future. And what we're working on right now is how we spend that money to best effect, and making sure that more of it gets into preventing people being ill in the first place. That is an important priority.
Do you ring fence the money for prevention? And when you give that money to local authorities, do you tell them to ring fence it? Because of course, if local authorities are under constant pressure, public health and prevention is not necessarily a priority.
Well, we do, yes, and that's important. And then, of course, within the NHS budget, that's in the direct control of government through the NHS, agreed with the NHS. So that is important. But I think that we've got to get more into GPs and GP surgeries and primary care in particular. I want to see more GPs, so it's easier to see a GP, so that they can help keep you out of the hospital in the first place as well.